Well, we just completed a very informative meeting here at 3M, which is one more example of an American company that is stepping forward to respond to the coronavirus here in the United States. And I want to thank Mike Roman, and especially I want to thank the incredible workforce here at 3M in Minnesota and all over the country that literally more than a month ago, when the coronavirus first made news, increased to full capacity their production of what we'll call respiratory masks, the N95 mask. It is a great tribute to corporate citizenship, a great tribute to this workforce. And Governor Walz and I have talked about ways that we can ensure that the broadest range of their respiratory masks are available for patients, and just as importantly for all of our dedicated healthcare workers across the country. We think there's work to be done at the present moment. As we learned today, the surgical mask, the N95, is available for hospitals, and they're producing roughly 4 million of those a month. And the spending bill that Congress approves today will make that continue to be available. But the balance of what they produce are industrial N95 masks that currently don't have protection under emergency provisions of the law. And Governor Walz and I are going to work with members of Congress to see if we can extend legal protections under the public health emergency that President Trump has declared, to make it possible for 3M and other companies in this space to be able to sell both types of masks to be available. We have testing expanding around the country. We know there will be more cases around America, and President Trump and our team, and I know Governor Walz, governors around the country are absolutely committed to making sure that anyone who contracts the coronavirus and all of the dedicated Americans that are providing medical services have the protective gear, and whether it be masks or gloves or eyewear. And we're going to be working with members of Congress to see if we can ensure that all of what 3M creates here, some 35 million masks a month, could be available to our healthcare providers. Questions?
Mr. Vice President, you mentioned 3M and credited them for ramping up, but you
Yes.
said you wanted to work with other companies. Does that suggest that you're concerned about a shortage, that there won't be enough? Following your comments about the average American who's not ill should not be getting, so is there concern that there is a shortage?
I think we are ready today, but we want to be ready tomorrow. Dr. Birx can explain, as we are expanding testing around the country, there are going to be more cases. We're going to find more Americans have contracted the coronavirus. Fortunately for most people that contract this virus, they will recover and recover fully. But there is a vulnerable population, and there are our healthcare providers, and so we simply want to make sure that we have all of the resources available, including what's called personal protective equipment for patients and for medical providers. But you might speak to your impressions. Dr. Birx.
No, thank you, Mr. Vice President. So we have been very fortunate that countries have been sharing with us their data, countries that had cluster outbreaks before us. And it's been very reassuring to look through their data and really see that the majority of the individuals who really have significant disease are older. And that really is very reassuring, but it means that there's more mild cases, and potentially even what we used to call subclinical cases, that could be infected and unknowingly spreading the virus. And so that's why we're very much interested in expanding testing, which we have worked very hard on for the last 72 hours, and have had some real breakthroughs in that ability to expand testing just over the last 24 hours.
Mr. Vice President, could you give us an update on the number of testing kits available? And a follow-up from the presentation before, could you explain to perhaps Dr. Birx why wearing those masks is not helpful to healthy people?
Let her speak about the masks, and then I'll give you an update on our progress.
So it is helpful for the healthy person, for the infected person to wear the mask, because it does block their ability for droplets to spew. And we know from information coming from other countries that that is where the virus is, in saliva and nasal secretions. And so if a person that is infected is wearing the mask, that decreases the amount of droplets that are available, the same way as coughing into your elbow or not shaking hands and washing your hands all of the time. So if those individuals who have the virus are doing all of those things, then the risk to the general public becomes less and less. But those masks won't protect you from the droplets because of for you wearing it, because you will pull air in through the sides. That includes the viral particles potentially.
And it's one of the ways that the American people can help us making sure that medical equipment is available broadly is by not buying masks, not taking them off the market, so that they're available for people that may become ill. And it may be beneficial for someone who is ill with the flu or coronavirus or any other respiratory ailment. But with regard to testing, as Governor Walz and I discussed, because of the changes that President Trump approved, now the state laboratory here in Minnesota and the universities here in this state and all across the country are able to conduct coronavirus tests. So that's expanded our capacity. We additionally this week have distributed 1,500 kits with roughly 500 tests each, so there's roughly about 1.5 million tests that have gone out to hospitals. A particular focus about hospitals in areas where we've had a coronavirus outbreak, but also requested hospitals. But earlier this week, we've had multiple meetings with our commercial laboratories, because as Dr. Birx pointed out, our enormous commercial laboratories, much like the company we're standing in today, have an almost limitless capability to distribute tests around the country. And we pulled those groups together. They formed a consortium to be able to share information and share resources, because our goal there is to make sure that while universities, state labs have the ability to test, while kits are going out to hospitals, we want just every bit as soon as possible for your doctor, for your med check, for your local pharmacy to also be able to have coronavirus tests, working in partnership with our commercial labs. We're confident that we're going to be able to address that within a matter of weeks and begin to distribute coronavirus tests much more broadly across the country.
But fair to say right now you still don't have enough.
We don't have enough tests today to meet what we anticipate will be the demand going forward. For those who we believe have been exposed, for those who are showing symptoms, we've been able to provide the testing. We're focused very much on a cruise ship just off the California coast today. The Coast Guard delivered a sufficient number of tests for the passengers on that ship. But as more Americans take an interest in this or have concerns about this, we want to make sure they have access to a coronavirus test as well, and we've made real progress on that in the last several days.
We're taking a couple more.
Governor Walz, Commissioner Malcolm, how is this going to work at the street level? Are we now to the point where somebody gets a culture from their local clinic and that test goes to the MDH or to the university?
I'll let the commissioner speak on this, but I would like to say just in the beginning, echoing the Vice President's remarks about 3M, we're grateful to hear a great Minnesota company being part of the solution, and then the collaboration with the federal government. The Vice President's being here speaks to that, of understanding that governors and state public health officials are going to be the ones that are going to have to be administering that. So that collaboration is happening, and I'll let the commissioner speak directly.
Well, as the Vice President Dr. Birx said, it is the goal to expand testing quite a lot in the country and in the state. Currently, the State Public Health Laboratory does have the capability to conduct tests. We've been doing that since Monday morning. We do not yet have the capacity for everyone who wants a test to get a test. Those kits are not yet distributed out in Minnesota outside of the Public Health Laboratory, but that is the goal, to begin to do that.
Let me say thank you again to 3M. Thank you to you, Governor, and your outstanding team. This has been a very informative meeting. We look forward to going back. And again, working with members of Congress in both parties to ensure that we have the full resources of the federal government and the full resources of the American economy. And at President Trump's direction and strong partnership with our state leaders, the American people can be confident we're ready, and we're going to continue to lean into this effort of the coronavirus across the country.
All right,
Thank you.
thanks,
Thanks, Vice